This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
There is no doubt that poor mental health takes an immense toll on the lives of affected individuals. Many conditions are barely manageable, if not to say debilitating, which prevents mental health patients from taking care of themselves and living their lives to the fullest. What is often left out from the discussion on mental health is how it manifests itself on a larger scale. This paper discusses the impact of mental health on society in terms of education, workforce, and safety. Mental illnesses have a profound economic impact on society. Suffering from a mental health condition often means reduced productivity and resourcefulness in individuals. This is not to say that mental health patients lack the skills or expertise to fulfill the assigned tasks. However, they struggle to find the energy and motivation to do so. Recent studies have shown that depression reduces activity in the frontal lobe, the part of the human brain that is responsible for higher-order mental faculties such as long-term planning and decision-making. It is readily imaginable how a depressed employee could fall short in these important aspects and underperform. Apart from that, mentally ill employees not only underperform, they may also be endangering the lives of other people. To put things into perspective, a WHO-led study evaluates the losses that the global economy experiences due to depression and anxiety disorders at $1 trillion. An individual's mental health affects his or her educational outcomes. Firstly, the same factors that prevent people from performing well at work, limited decision-making, and the inability to plan long-term stifle academic performance. On top of that, it has been found that two other components that often accompany mental illness, anhedonia and social dysfunction, the most influential component, play a significant role in shaping educational outcomes. Not being able to take pleasure in learning and function in society often leads to dropouts. Lastly, there is a link between psychiatric disorders and criminality and violent behavior, though its nature is still debated. Admittedly, that is not to say that all people with mental conditions are dangerous. That would be a harmful generalization. However, the inability to receive timely and adequate treatment, experiencing illusions and hallucinations, as well as suffering from paranoia are all risk factors for delinquent behaviors. Mentally ill individuals are arrested and sent to prisons at a disproportionate rate, primarily because the justice system has not yet figured out the best way to handle them. Conversely, this category of people is also at risk of falling victim to violent crimes. To recapitulate, unmanaged public mental health concerns reduce safety, be the problems caused by mentally ill individuals or not. Indeed, it is not only the individuals but also society as a whole that suffers from the adverse consequences of deteriorating mental health. Poor mental health is linked to underwhelming work performance, as affected individuals are not able to be as efficient at work as they could be if they were not suffering from their conditions. Academic performance also suffers, mainly from anhedonia and social dysfunction, while the high dropout rate means fewer qualified cadres in the workforce. Mental disorders translate into not tremendous economic losses worldwide. Lastly, unmanaged mental health issues may lead to crime outbreaks, as some people can no longer control themselves or put themselves in risky situations. This essay on the impact of mental health on society was written and submitted by a student just like you. The Ivy Panda Samples database hosts thousands of works similar to this one on various subjects. Visit ivypanda.com to find what you are looking for, free of charge.